Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Well, tonight we have a doctor from Catholic Health Services to help you sort through what's going on with COVID-19 in our communities and across the region. And we want to hear from you. This is a call-in show. So call us at the number at the bottom of your screen, 516-393-1800. Now, here are the numbers right there. A warning today from the governor this afternoon saying there is no American immune to this virus, and the worst is still to come. The skyrocketing number of cases are hitting that point home, as you can see. New York now exceeds 66,000 cases. Look at the numbers in Nassau. That's more than 7,300. Suffolk, 5,700, almost 6,000. And the death toll in New York, as expected, rising, now surpassing 1,000. Statewide, 1,218 have died. In Nassau, that number is up to 48. Suffolk, 44 people have died as of today. Now, Governor Cuomo spoke today from the Javits Center in Manhattan, which is now open as an emergency temporary hospital. The Army Corps of Engineers transformed the convention center into an overflow medical facility. The space holds 1,200 hospital beds for non-COVID patients. These are non-COVID patients. Work is still being done on Long Island to turn SUNY Stony Brook and SUNY Old Westbury into similar facilities. And the Navy ship, the USNS Comfort, is now docked in our harbor, New York Harbor. The ship will be used to treat non-coronavirus patients again. That'll free up space in city hospitals. Cuomo says this will relieve stress on an already strained system. Now, the Comfort holds about 1,000 hospital beds. It has several operating rooms, and it also has an onboard pharmacy. Today, Nassau executive Laura Curran had a very sobering announcement. She said until further notice, there will be no funerals, no wakes held for anyone who passes away at this time, and that's all due to the pandemic. Long Island-based medical supply giant Henry Schein rolling out an antibody rapid blood test that gives virus results in about 15 minutes. That's instead of hours or even days. The rapid test doesn't need lab machines, and it's designed to be used in doctors' offices. All right, let's get right to it. Joining us tonight is the Chief Clinical Officer for Catholic Health Services, Dr. Patrick O'Shaughnessy. Thank you, Doctor, so much. I know this is, you're working, I can't even imagine the hours you're working, but you take the time to come out here and talk to the public. So we thank you very much for all you're doing and for taking the time for speaking with us.
Oh, Stone, please, it's not me. I want to take a moment to recognize all of the physicians out there, especially our doctors at Catholic Health Services. Actually, National Doctors Day. They are the real heroes, not me. I used to say, they're the leaders. I'm a cheerleader. I'm here to help and help get them what they need. And it's remarkable to see the response that all of the communities and all of our physicians and caregivers and nurses are providing relative to this pandemic.
Yeah, they really are the heroes right now. The front lines are in the hospitals as we speak. So let's get right to some of the calls right now. Larry from St. James, are you there, Larry?
Yes, I am. Thank you for taking my call.
Yeah, what's your question tonight?
Well, two questions. The first one is I seem to remember either hearing or reading that there are certain blood types that they weren't sure that, like O positive or A might not be affected by this virus. And the second one is they're looking to take people's blood that have already had the virus and make something out of it to treat people that do have it. I mean, are the people that have had it already, are they prone to still get it again?
Doctor, are you hearing any of that?
Yeah, so let me take the second question first, because what Larry's referring to is what's called convalescent plasma therapy. And what that does is it actually will take antibodies from people who have recovered from COVID-19 and transfuse them into patients who are, at this point, critically ill. It is an experimental treatment because we don't have clinical trials demonstrating benefit. But when you look back to past occurrences of outbreaks, whether it even be Ebola, these were techniques that we used to try to help people. In fact, published just today in JAMA, the Journal of the American Medical Association, some case reports do show favorable results with convalescent plasma treatment. So health systems abroad, across the United States, Catholic Health Services is one of them. We're taking active steps to begin to mature that process so that as more and more patients do recover, and again, 80% will recover, if they meet inclusion criteria we would want them to be enrolled to donate blood, and we can use that to potentially help people who are critically ill. Again, still experimental, but we do think it offers benefit. In regards to his first question, I'm not aware of any differences within blood type that would convey either increased resistance to severe COVID infection or offer some degree of perhaps weakened immunity to it. Again, there's a lot of different theories around blood cell types and different types of responses, so I don't want to comment on that. I think time will tell as the overall case reports make their way to the statistics books in time about how many people got critically ill or not by blood type, by age. And I think it's more likely, again, folks with concomitant or coexisting medical conditions, especially things related to emphysema, diseases in the lungs, diabetes, hypertension, coronary disease, cancer. If they're on any type of immunosuppression, they're going to have much more risk for advanced disease.
Okay. Let's go to Veronica from Rockville Center. Veronica? Veronica, you there? Okay, if we don't have... Veronica, is that you? Okay, how about Annie from Seaford? Annie, you there?
Hello?
Hello, is this Annie?
This is Veronica.
Oh, Veronica. Okay, we're back to Veronica, Rockville Center. What's your question tonight?
Okay, so mine was in regard to some home remedies. So I know that elderberry is known to be an immunity booster, but I did hear that it does affect the cytokine storms when it's involved with the coronavirus and can ultimately be fatal. So I was just wondering if that should be taken if you do come down with the virus, or if you should stop taking it.
So there's a lot of, I think, anecdotal evidence being published around different types of alternative treatments and things that could potentially help you in terms of immune response. I commented on this a little bit in the past relative to when I was on News 12 before, things such as making sure you're eating well, getting enough rest. I do believe in supplementing, when possible. I don't want to say that there's good scientific evidence. There's a lot of case reports actually out of China, actually, in addition to the chloroquine and hydroxychloroquine and Zithromax, actually, there were case reports of people getting some benefit potentially from IV vitamin C treatment. So again, that gives a lot of folks some thoughts of, well, then maybe I should be taking doses of vitamin C. There are other herbals out there, supplements, as you mentioned as well, Veronica, that folks do traditionally use to try to help boost an immune response, like elderberry, like golden seal, like ashwagandha, all these different things. Again, my advice would be to you, consult with your physician if you have questions, because there could be all kinds of different reactions as well, relative not just to, you mentioned cytokine response, but if you have other medical conditions and you're on medications. So my advice with all of that is, number one, talk to your doctor and make a personalized plan regarding any supplement use if you feel it's going to offer benefit.
Great. Okay, so now let's get Annie from Seaford. Annie?
Hi. My daughter was tested 13 days ago. What is the average length of time it takes before results come back from the private sector?
Okay, so turnaround time, what we're seeing in our health system, we generally get results turned around within 48 hours. Sometimes depending on surge, and we try to prioritize testing. Again, it's a good thing we're testing so many people, but there are instances where I've heard of backlogs for people waiting 4 or 5 days for testing, and these may have been people, to your point, treated in an alternative environment, not in a hospital-based setting. So in general, on the hospital side, again, if you meet CDC testing criteria and you are tested, we're getting those tests turned around generally within 48 hours. Again, if you're not getting your test resulted, I would ask you to escalate that through the appropriate channels to make sure for some reason it didn't get misplaced, or just get a sense of where it is in the queue.
Okay, let's try to squeeze another question in. Dave from East Atlantic Beach. Dave?
Yes, hey, thanks for taking my call. So we have a 4-week-old baby at home who's perfectly healthy as of today. Now, both my wife and I were diagnosed with coronavirus a couple weeks ago, and we are currently symptom-free, so we appear to have beat it. The baby has never had any symptoms. My question is the baby possibly infected and we don't know it? And should we be concerned with having, his grandparents come and him possibly infect them or any other visitors for that matter?
So it's a really good question. The baby you mentioned is completely asymptomatic at the moment, which is great. And I don't know, you didn't share if you guys, you both had it. I actually know of parents where one may have had it and one didn't have it. They socially distanced. They actually quarantined within the home, and the baby was segregated off in the clean zone, so to speak. And I would say, from what you've shared with me, I think it would be prudent to just to be safe. Bring the baby into the pediatrician or make a call. Call the physician, call your pediatrician's office first, right? And share your concern. And usually what they probably would advise at this point is just watchful waiting. But again, I'm also a dad, so I know the concern you and all parents have, and just keep a close eye on it. They may recommend that they proceed with testing if any symptomatology begins to develop. Again, signs you want to look for are fever, cough. But again, that's a 4-week-old, right? So that's a person, in the younger age risk. So I would want to be ultra conservative with that. So my advice to you would be call your pediatrician and continue to monitor and make sure that the baby has no signs and symptoms.
Yeah, so, and one of the concerns, doctor, and correct me if I'm wrong, is that even though the baby may be symptom-free, asymptomatic, that baby could then spread that to someone who would be more vulnerable.
That's right, and that was the other part of his question. Thank you, Stone. So in other words, if grandparents are going to come over and visit, you want to be extra careful about that. So again, best advice, anticipatory guidance, call the pediatrician, consider possibly, again, socially distancing until you know for sure. And I'm really glad to hear that you guys are both doing well, and so far the baby's okay.
Yeah, Dave, good luck with everything. I hope you guys stay safe. All right, we're going to take a real quick break. We're going to have much more expert advice on how to keep you and your family safe from the coronavirus. And remember, we want to hear from you. Call us now with your questions. That number right there at the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Remember, we want to hear from you. Call us at the number at the bottom of your screen, 516-393-1800. Let's bring in Dr. Patrick O'Shaughnessy again. He's the Chief Clinical Officer with Catholic Health Services. Let me ask you this, Doctor. The governor today, we're talking about some pretty staggering numbers. We're at 66,000 New York State wide confirmed cases, more than 7,300 in Nassau County, more than 6,000 in Suffolk County. Do these numbers trouble you?
So they're expected. I mean, we've done such a great job now with testing. I think we were slow out of the gate, and I think the governor has acknowledged that. We've acknowledged that, as a country, we need to develop additional resources to make sure that we're able to keep up and supply on the testing side. So we're testing more people. So as you test more people, you're going to find more positives. So, and I think, I've been on various calls with the governor, and also part of that following his conference, I think he's doing a great job, and he's sending a clear message that we all need to do. So when people ask me, what can I do to help? I always say, follow the recommendations, stay home. We shouldn't be overly alarmed. We're going to see cases continue to go up. And I think the next, 3 to 4 weeks are going to be very telling for how this all plays out.
Okay. Back to the phone lines. Tony from Oceanside. Tony?
Yes, Scott, thank you. Stone, I'm sorry, thank you. Doctor, what I want to ask you is why the mixed messages with the masks? At first we were told that if you are healthy, the mask isn't really going to help you. It's more for people that are sick, that maybe they're going to spread their germs, their droplets. Now it seems to be swaying in a different way, that maybe it would be advisable to wear a mask. And I say this with great sensitivity because I have not chosen to wear a mask because I believe it should be for the people in the healthcare profession and what have you. But now you're getting mixed messages. And me not wearing a mask, when maybe it could be beneficial, doesn't that help to decrease the numbers of people infected?
Okay, doctor?
Yeah. So it's a great question. And again, there are different types of masks, right? So obviously the mask that is of most importance in terms of preventing spread is what's called an N95 mask, which means the N means 95 means it separates out 95% or greater of particulate matter that could be at risk for infecting someone. So, we've had challenges with PPE, right, throughout the country and throughout New York State. And I think, our leaders and others have done a great job to try to get us what we need, but it's still a challenge. So I can't tell you how much I appreciate what you just shared, which is you're trying to do the right thing and save masks for healthcare workers. Now, to your question as to whether or not it offers protection to you, the more common procedural masks that you see perhaps a surgeon wear in a TV show or whatnot, that really, all that is going to do is prevent you, if you have something, from droplets coming out and spreading it to somebody else. So again, there may be some degree of protection because you are less likely to then spread respiratory droplets if you're wearing a mask. But again, if we're following all the recommendations that the governor and the health departments have put out, which is really to stay home unless you are an essential part of this response, that's probably the best thing that you can do right now. And again, I appreciate the advice on conserving masks. So again, N95s are the true, we actually call those ventilators. We don't even just call those masks, we call them respirators. And the procedural masks really are not going to protect you fully from contracting COVID. They may limit the amount of droplets that you spread, but they're not going to be a true barrier.
Okay. Jean from Hampton Bays. Jean?
Hi. Thank you, Stone. Thank you for taking my question and doing a great job every night. I love it.
Thank you.
My question for the doctor tonight is, the experts say to use antibacterial wipes or a spray, antibacterial spray, or a paper towel, and clean your countertops, your knobs, your doorknobs, your handles. If I use the same paper towel or something, am I spreading the virus, or should I change it every time I use it on the counter, or change it when I do the knobs?
Okay, that's a great question, doctor.
That's a great question. So with any type of in a viral infection, there can be spread on what are called fomites. F-O-M-I-T-E. Fomites are inanimate objects or things that we touch very frequently, right? Like door handles, like phone handles. All these things can transmit. So it is good advice if you have a disinfecting wipe or a spray that you're going to use a paper towel, wipe everything down and change the paper towel, okay? Because that could be the weakest link if you touch a contaminated surface. Again, in medical school, we're taught how to do aseptic technique. And I think through proper cleaning and disinfecting and hand washing, we could really reduce the spread. So I think you're doing a great job. That's a great question. Keep wiping down those high-touch surfaces, right? The doorknobs, the phones, refrigerator door handles, bathrooms, especially the sinks, right? So the sink handles, the toilet bowl flusher, right? I know it sounds disgusting, but that's like a key area. You got to wipe that all down. And I would change the paper towel if you could. Yeah, that's great advice. And your pen. When you touch your pen, I can't tell you how clean this pen has become. And your phones. And your phones.
Your cell phones. That's perfect advice. Yeah, Dr. Patrick O'Shaughnessy, perfect, great advice tonight. Thank you so much. I want you to stay safe. You are on the front lines, and you're really the heroes. And on behalf of Long Island, I know every caller and everybody watching this is benefiting from the great advice that you give us. So thank you very much. That's all the time we have. You're watching our coronavirus pandemic special report. We will be back tomorrow night at 7, so you come back too. We'll be right back with your full hyperlocal forecast.